So many things happened since our partnership started. So we will take a moment to think about the major steps of our journey together and what comes next. The incessant work from Aortic Dissection Awareness, UK and Ireland, on increasing awareness for this major health problem changed the way the public and many clinicians look at the disease in the past years. Our team at University of Leicester shares the patient association interest, as testified by the research work published in the past years and by the ongoing projects we are currently running. In 2019 we met and we formed a partnership to make sure that the Aortic Dissection Awareness Day would become a great opportunity to discuss and progress in the research around this disease, with a particular focus on the screening possibilities. We reached friends and colleagues across all England, and even beyond the ocean, in order to plan a Delphi initiative that would bring together patients' experience and clinicians' ideas. We listened to each story and to each point of view, and we offered a chance to discuss for all patients and clinicians involved, both in a digital form and in a face-to-face meeting. This resulted in 8 posters that were on display during the Aortic Dissection Awareness Day 2019. These were an excellent conversation starter, greatly appreciated by all the attendants. Moreover, lately, this initiative brought to a full publication in a peer-reviewed journal, in which everyone in our group was a co-author. In the paper, we outline the conclusion we reached and the consensus we agreed on, and we plan the next steps of our work. Next steps, which will include the results from REST, the feasibility study we recently completed. In this work, we recruited patients with aortic disease that had an operation in the last 3 years, and we offered a genetic test and an MRI to their families. This brought us very helpful information to show how often this disease might be a risk that runs in the family. Along with the high number of diagnoses, we also showed how this approach could be easily implemented and that gene and images are equally important in the care received by these patients. By bringing together the things we learned from these 2 initiatives, we are currently moving on to the next phase of our research collaboration. In the months following Aortic Dissection Awareness Day 2019, we formed a group made of all the experts that could be involved in the care of aortic disease patients and sat down each month to turn the research needs into research projects. The things we learned helped us so much. But so much more is needed before we are able to plan a proper randomized controlled trial. We have been studying a series of different interdependent work hypotheses to answer the outstanding research gaps that will hopefully improve the care that the patients currently receive, with the ultimate aim of putting together a trial led by a patient initiative and designed along with them. There is much more left to do, so we might as well get back to it now, since, as you perfectly know, today is a good day.